Hi, this is Dr. Karina Hopen from the Mount Vernon CBOC. Thank you for accessing this presentation on chronic pain and opioid use. This is a patient information guide that you can receive at the CBOC, and it contains information you need to know to understand how the VA uses opioids to treat chronic pain and how to take opioid medication safely. Opioids can be dangerous if they are not taken responsibly. Chronic pain care involves more than medications, and your involvement in increasing activity, learning strategies to decrease pain, and taking care of all of your health needs are important for success. Opioids alone are never a solution and may not be safe for everyone, even for a short period of time. Even if opioids are used, it is best to use them in the lowest dose for the shortest period of time and use other options for pain care as well. Every decision about opioids is made reviewing the risk to determine if they are safe to use. There are many options for pain care. Work with your provider to see what the best choices are for you. In addition to opioids, other things to manage pain and improve your quality of life include such things as heat and cold therapy, cognitive, physical, occupational, mental health therapy, acupuncture, chiropractics, nerve stimulation, weight loss, and massage. Any one of these can help to reduce pain, but they may work better together. Here are additional examples of other approaches for pain. Because opioid medications can be dangerous, they can only be prescribed if you follow these do's and don'ts for taking opioids responsibly. Do take your opioid and non-opioid pain medications as prescribed. Make sure you take the right dose of medication at the right time. Don't avoid taking your pain medication to save it for a later time. Don't take extra doses, as it could get you very sick or you can die from an opioid overdose. It can cause you to run out of opioids before you get your next refill, which may lead to withdrawal symptoms. Your provider will usually deny requests for early refills. This protects you and the public from harm due to opioid abuse and addiction. If you have severe, increased, or new pain, don't just take more of your opioids. Call your pain treatment provider or clinic to decide on the best care. Do inform all of your providers that you're currently prescribed opioids. Do tell your usual VA provider if you get an opioid prescription from another provider. Do tell your provider about your health care that you're receiving from non-VA providers. Tell them about medications or supplements that you are currently taking that are not prescribed by VA providers, and this includes marijuana. Coordination of pain management services is important to ensure your safety. You should know that your VA provider may choose to alter your pain management plan of care, including long-term use of opioid therapy, to take into account non-VA provided care that raises safety concerns. Don't stop taking opioids on your own. If you stop taking opioids suddenly, you may have withdrawal symptoms. If your provider asks you to slowly decrease your use of opioids, follow their advice, as this will help reduce withdrawal symptoms and prevent you from feeling sick. Tell your provider if you think you are having withdrawal symptoms. Your provider may be able to give you medications for a short time to help control them. Do be cautious about driving or operating machinery. Never drive or operate machinery if you feel sleepy or confused. State laws may determine what kinds of jobs you can do when you're taking opioids. You may not operate heavy machinery like a truck or public vehicle like a bus. Don't drink alcohol or take street drugs. It is unsafe to drink alcohol or use illegal street drugs when you are taking opioids, because it can impair your ability to manage your opioid therapy and cause severe harm or death. Some drugs can interfere with your pain care or opioid therapy. If you abuse alcohol or use street drugs, your provider will encourage you to get treatment for this program. Treatment for alcohol and drug abuse will not interfere with your ability to get treatment for your pain or other conditions, and this treatment may be helpful. Do get help from your friends and family. They may be able to work with us to help you manage your opioid therapy safely. And don't sell or give away your opioids. Don't let any other people take or use your medications. This is dangerous and illegal and can lead to criminal charges. To keep your medications in a safe and secure place is very important. The VA may not replace doses that are lost, stolen, or shared with others. If this happens repeatedly, your provider may stop opioids completely. And as mentioned, these are some of the withdrawal symptoms. It is important to report any side effects to your provider because it will help you and your provider develop a treatment plan that balances harm, which are the side effects and risks, and benefits, which is the pain relief and how well you function. Sleepiness or slow thinking is one symptom. Opioids can impair your judgment and cause problems with how you make decisions. Sleepiness can lessen over time, and caffeine may help you feel more awake. Mental confusion, bad dreams, or hallucinations may occur, and your provider may need to change your dose or medicine to treat these side effects. Constipation is a common side effect that may not go away. Laxatives can improve bowel movements. Regular physical activity, a diet high in fiber, and drinking more water may also help. Itching is rare, and it usually occurs early in treatment. Your provider may need to change your opioids and order medications to treat the itching. Wearing light clothes may decrease sweating. Nausea and vomiting can occur late or early in treatment, and this usually goes away in time. Your provider may give you medications to control nausea. Decreased hormones that affect sex drive, sexual arousal, and other aspects of your health can occur. Opioid use may decrease sex hormone levels and your desire to have sex. In men, opioids may decrease your ability to have an erection. Decreased sex hormones may also cause depression, anxiety, tiredness, hot flushes, and night sweats. It can also cause a loss of muscle mass, weakness, brittle bones, and bone fractures. Women may have irregular or no menstrual cycles. Use effective birth control methods to prevent pregnancy during opioid treatment. Tell your provider if you are pregnant or plan to become pregnant. Opioids may harm your baby if you take opioids while you are pregnant. Allergic reactions to opioids are rare. If you get a rash or hives, notify your provider. If you become short of breath, have throat swelling, or feel like you may pass out, tell someone to call 911 right away. Sleep apnea is an abnormal breathing pattern that occurs during sleep, and this is a serious side effect that could potentially happen. Your provider may ask you about your sleep habits, order tests to check if you are at risk for sleep apnea, and if you do, you may be advised to only use non-opioid pain therapy or prescribe a breathing machine for you to use when you go to sleep. If you do have sleep apnea, avoid alcohol and medications that can make sleep apnea worse. Worsening of pain can occur as a result of opioid use. Impaired driving can occur as well. Never drive or operate machinery if you feel sleepy or confused. To ensure public safety, state laws may determine what kinds of jobs you can do. While you are using opioids, you may not operate heavy machinery or drive a truck or public vehicle like a bus. With long-term opioid therapy, you may need a higher dose of opioid to get the same pain relief, resulting in an increase in the likelihood of many of the other side effects and risks. Withdrawal symptoms or physical dependence can occur. Your body will get used to receiving opioid medication, and you may suffer withdrawal symptoms if you suddenly stop taking opioids, or taking them too quickly, or take a drug that blocks their effects. People who take opioids for a long enough time period become physically dependent. And this is not the same as addiction. Some patients, but not all, may become addicted to opioids. Addiction means there's a craving for a substance, and cravings get out of control. If you show any signs of addiction, your provider is likely to refer you to an addiction specialist or a substance use treatment program. Your provider and addiction specialist may cut back on your dose or stop opioid therapy. They may prescribe non-opioid medicines. They will help you with your pain using non-opioid treatments. During drug interactions sometimes can occur. Tell your provider about all of the pills you're taking, including herbs and vitamins. Immune system changes can occur as well. Opioids may make the immune system work poorly. Taking opioids long-term may result in infections or immune-related illnesses. Opioid during early pregnancy has been associated with increased risk of rare birth defects. If you are or plan to become pregnant, talk to your provider about your pain treatment options. And lastly, opioids are one of the main prescription drugs associated with deaths in the U.S. Death may be more likely when you take larger doses of opioids. Protect your opioids from damage, loss, and theft. Keep them in a safe, locked place and out of reach of family, children, visitors, and pets. Store them in the original labeled containers, and during travel, carry the current bottles with you. Discuss any concerns about the safety of storing your medications with your provider, and report any stolen opiates to the police. For renewing your medications, call the narcotic line at the number listed. You cannot fill prescriptions on weekends, holidays, or after regular clinic hours. You should receive all of your mailed prescriptions at a safe address, or consider picking them up at the Seattle VA pharmacy if you do not have a safe address. Make sure that no one else can sign for them or take them. It's important that you be honest about your personal, family, drug, and alcohol history. Ask questions. Same-day care and emergency room staff are not good places to get treatment for your chronic pain. If you do have to go to the emergency room, tell the doctor about your pain care plan. You will need to meet with your doctor at least once per month upon starting opioid therapy, and at least every 6 months once your treatment is stable. Try to keep all of your pain care and other clinic visits if possible, and update your contact information at every visit if there have been any changes. Opiate prescriptions require veterans' consent to annual random urine drug testing. It ensures that you're taking your medications and that your body is metabolizing them. It also checks the urine for drugs not prescribed for you, like street drugs and alcohol. The VA does not use these tests for law enforcement or employment purposes. The results of these tests may cause your provider to talk to you about keeping or changing your plan. If you have to stop opioid therapy, it may be stopped due to the fact that it's not helping you for addiction or abuse or misuse reasons. Your provider will try to prevent or control any withdrawal symptoms, and your provider or pharmacist will tell you how to properly dispose of partially used or unneeded opioid remaining from your prescription. For your safety, your provider and pharmacist will monitor when you renew and refill your opioids both within the VA and when allowed by law outside the VA. Most states have programs that track prescription drugs to identify and address inappropriate or unsafe patterns of controlled drug use. VHA will not give your information to a prescription drug monitoring program without your specific consent except when allowed by law. So in summary, opioids alone may not be safe for everyone, even for a short period of time. It's best to use opioids in the lowest dose for the shortest period of time. Every decision about opioids is made reviewing the risk to determine if they are safe to use. There are many options for pain care. Work with your provider to see what the best choices are for you. Thank you for your attention, and if you have any other questions, please present them to your primary care provider. Thank you.